Hi, my name is Linda Spencer, and I'm a speech-language clinician and a researcher. And I've worked on a cochlear implant project, and I'm now with New Mexico State University in Las Cruces. Some children will have such a severe hearing loss that their hearing aids will not be helpful to them. In that case, some physicians will recommend that the child be assessed for a cochlear implant. Now, a cochlear implant is what we call a prosthetic device, which means that it replaces something that a person does not have. You've heard of a prosthetic arm or a prosthetic leg. Well, a cochlear implant is actually a device that provides direct electrical stimulation to the auditory nerve. And it is used with people who have the most profound or the most severe hearing loss. So some children will be candidates for this cochlear implant, and that's something, if you're curious about it, would be appropriate to ask your audiologist or your physician whether your child is a candidate for this. What a cochlear implant will do is it will provide the child with auditory stimulation, and now that stimulation is not going to be speech that is loud or amplified. It is now actually an electrical stimulation. So the child will wear an external piece that looks a little bit like an overgrown hearing aid that has a microphone on it, and that external piece will pick up sound from the environment, change that sound into an electrical signal, which will then be transmitted to an internal device that is physically, surgically implanted into the child's head. Then that piece of the equipment will electrically stimulate the auditory nerve. Now, children who get a cochlear implant will perceive sound at levels that are much quieter than children who have a hearing aid. So, for example, conversational speech, if you're listening to me right now, you're hearing me at about 50 decibels. And the cochlear implant will first pick up sounds at about 10 to 20 decibels. So that means the child will be able to pick up sounds across low frequencies, like low tones on a piano, to high pitches, like birds chirping, at relatively quiet levels. So the advantage of a cochlear implant is that the sounds of our speech and language will be transmitted across all frequencies at much quieter levels. So these children will be able to pick up quiet speech. The procedure itself is a surgical procedure. The physician will make sure that your child is old enough, has gained enough weight to undergo a surgical procedure. Typically, it is not until a child is 12 months of age that they are candidates for a cochlear implant, but in certain circumstances, a physician will make a judgment and say that this child can be implanted a little bit younger than 12 months of age. And that's something that the surgical team will evaluate the child for. If your child does receive a cochlear implant or is a candidate for the surgery itself is a 3-hour surgery. They will do a little bit of a shaving of the hair right above the ear, and there will be a scar about this big afterwards. Typically, children are in the surgery for 2 to 3 hours. Then they are in recovery for an hour. And typically those children wear a pressure bandage after the surgery, and they're actually allowed to go home that night if they're keeping down fluids and liquids, if they're not too nauseous after the surgery. I'm trying to think what else would be important here. Questions to ask your audiologist or your surgeon would be, is my child a candidate for a cochlear implant? Is their hearing poor enough that they're not going to get good benefit from a hearing aid? is my child a candidate for one cochlear implant or two cochlear implants? Would the surgeon consider doing two cochlear implants so that the child has a cochlear implant on each ear? The benefit of having two cochlear implants is the ability to hear in noise and the ability to figure out where sound is coming from, so localizing sound. So those are questions to ask. And if you are thinking about a cochlear implant, it would also be appropriate to ask your physician, ask the surgeon whether he or she has done a lot of these procedures with children. You want to get a surgeon who has had a lot of experience with implanting the device in a small child's head, and so you want to make sure that they've had a lot of experience with that. You want to make sure that the operating team has experience with pediatrics, so that the anesthesia person has worked with anesthetics, with the pediatric population. And you also want to know whether the cochlear implant team that will actually be doing the programming of the external device has had experience working with children, and that they're child friendly, that they understand that it takes time to program a 12-month-old baby and that there are certain procedures that need to be followed. And if that's an interest, I think it's appropriate to ask your team. Thank you.